Now, how to get to this determination, whether the life has changed and whether it is a result of the accident, of the injuries. So there are 6 divisions of this test. The first is the injury diagnosis. And we've discussed that already. That is, what parts of the body were injured and what is the diagnosis or the description of injuries that were caused by the accident. Secondly, and that is a pure medical determination. Secondly, the outcome diagnosis. That is the diagnosis of the chronic condition that has arisen from the injuries. And then it is also necessary for the medical assessment to determine the nexus. In other words, in relation to the nexus between the injury diagnosis and the outcome diagnosis. So here are examples of outcome diagnoses: post-fracture syndrome with malunion and deformity, post-traumatic organic brain syndrome, intermittent mechanical back pain, and post-traumatic stress disorder. But it is essential for the medical practitioner to determine that this outcome diagnosis is or is not, or is in part, a direct result of those injuries. And without those 2 determinations, injury diagnosis and outcome diagnosis, one cannot go forward. So those are the 2 fundamental requirements. Then, because of the fact that the Act specifies taking circumstances into account, this explains how to take circumstances into account. And in this, we differentiated between 2 kinds of circumstances. The one we called external circumstances of the person's life, and the other we called individual circumstances of the person's life. Now, the external circumstances are the country and the town in which you live, the family in which you live, your cultural affiliations, your religious affiliations, access to healthcare. Those are all things which exist outside of you. It is the context in which the injured person finds himself or herself. Those external circumstances usually remain the same after an accident, so they are usually not changed by the injuries, although in certain circumstances they are changed. So if the person's consequences of the injuries required the family to move to a different town with better access to healthcare, that could be a change of external circumstances necessitated by the injuries, and which is therefore part of the outcome of the injuries. Then the individual circumstances deals with what that person himself or herself actually does. So that includes their ability to perform basic and advanced activities of daily living, their personal amenities such as sporting, other recreational activities, their life roles such as parent, child, sibling, spouse, etc., their independence or any degree of dependency, their educational status and capacity, and employment status and capacity. So those individual circumstances are the aspects of a person's life that are most often affected or changed by the consequences of injuries. So it is necessary to report and consider both the external circumstances and the individual circumstances.